To welcome you to our monthly Strengthening Families Networking webinar for August. We're talking today about some of the projects going on at CSSP that go beyond strengthening families but still focus on young children and their families and are very much connected in with our ongoing work about trying to improve outcomes for children and families. So I'm glad that so many people were able to join us today, even in the middle of summer when a lot of people seem to be on vacation. Thank you for joining us. I'm Kailen O'Connor from the Center for the Study of Social Policy. I will talk a little bit about these networking webinars for anyone who's new. Then we'll hear some updates from our partners at the National Alliance of Children's Trust and Prevention Funds from Martha Reeder. And then we'll get into talking about CSSP's Young Children and Their Families team with a spotlight on two specific areas of work. So let's go ahead and jump in. I'll talk a little bit about these webinars. I know some of you may not have been on one before, so I just wanted to orient you to where you are. We issue this open invitation to a monthly webinar for anyone using the Protective Factors Framework or coordinating strengthening families efforts in their state or community. It's a joint convening hosted by the Center for the Study of Social Policy and our good partners at the National Alliance of Children's Trust and Prevention Funds. Each month we have a specific topic, often with guest speakers, which are either coordinated by CSSP, by the Alliance, or by a volunteer from the Strengthening Families National Network. Those are typically folks who are in state lead positions for Strengthening Families efforts, but we welcome other volunteers. If you have a topic that you'd like to share and pull together other speakers to share your experiences on, let me know. And finally, I wanted to make sure everyone knows that the recordings and materials from these webinars, going back a long time, are posted on a Google site by the Alliance. We also post the recording on the CSSP webpage, and you'll see a link to it in the Strengthening Families e-update newsletter when that comes out, usually the week after the webinar. Just a couple of webinar tips from GoToWebinar. If you're having any trouble, the first thing to check is in your attendee control panel, you have to choose whether you're using the telephone or the mic and speakers. Many problems arise if you tell the computer you're using the mic and speakers, but you're actually on the phone. So please check that, and then there are some tips here. I'm not going to read through them, but if you are having any problems, please try those, and then you can send a message in the chat box, and Trish or I will try to help you. But generally, these will solve your problem. Okay, I wanted to give a little sneak peek of what's coming up. And on September 10th, because we do meet on the second Thursday of each month at this time, September 10th will be our next one, where we'll be talking about protective factors approaches to supporting foster care and resource parents. Kate Beejan, one of our state leads in Rhode Island, is leading that work. We'll hear from several participants in our ongoing long-time working group about strengthening families and child welfare. And on October 8th, we'll be talking about promoting family engagement through quality rating and improvement systems. Michelle Trollswood from Arkansas is coordinating that one. And we have a good lineup of topics beyond that. Just wanted to share those couple sneak peek ones. And go ahead and mark the second Thursday of each month. We'll let you know what the topics are as they come up. Okay, I want to hand off to my colleague Martha Reeder from the National Alliance of Children's Trust and Prevention Funds, who's going to share some updates from their work.
Good afternoon, everyone. Hi, Kailen. I just have a few things to share this afternoon. One has to do with our work with the Birth Parent National Network. And in case you needed just to be reminded what that is, we have a project with the Casey Family Programs to create a Birth Parent National Network. It has been growing over the past year, and they are doing some amazing work. I was just on a call with them this morning, and then it's just some basic information about it. It's for both organizations and individual parents, and it really promotes those parents' voices that are that have been involved in times past or at risk of becoming involved with the child welfare system, and they're interested in engaging in policy work and systems reform, and they're willing to use their time to do that. Let's go to the next slide. And the reason I wanted to remind you what the Birth Parent National Network is that in November, They are having a virtual convening, and these are the dates. There will be 3 2-hour sessions on in different weeks of the month, and all of the sessions are from 10 a.m. till noon Pacific time. And during these, we will have some very distinguished keynote speakers, including Dr. David Sanders, who will be on the Tuesday, November 10th convening. On a lot of the other convenings, there will be others, and we're still working out exactly who that will be, but the Birth Parent National Network members, they facilitate their own calls, and they will also be facilitating a large part of this virtual convening. They will discuss trends and possibilities in child welfare reform and all the things that they're learning from the work that they're doing in the Birth Parent National Network. So if you'll go to the next slide, we will be sending out some information about how to participate in the convening. You need to be a member of the Birth Parent National Network to do this. And if you know of any parents or your organization would like to be involved in this, there's some information here about how you can join the Birth Parent National Network. Meryl Levine is the senior consultant at the Alliance that is the point person for this project, and so please feel free to contact Meryl if you have any questions. Let's go to the next slide. Just, I guess you I didn't realize that it had all of these action points in here, but I wanted just to give you an update on our training of trainers around protective factors framework. And this is just a little bit of a slide about some of the impact of the training. We can go to the next slide. A map of where we have trainers now. This map is no longer correct. We have 360-something trainers now, and we are planning 3 more trainings before the end of this year, and one in Arkansas, one in Washington State, and one in California. So we are also beginning to plan next year's training events, and so if you are at all interested in talking to us about bringing this training to your jurisdiction, your locality, can you go to the next slide? Then just do contact us. You can look on our website for some specific information about our training materials and training programs, and also you are free to contact me at any time if you would like more information about how to become a certified trainer or how to host a training in your locality. And that's all I have to share today, Kailen, and I'm glad to be here, and I'm glad to see everyone's faces and your names on the attending list. It looks like a really great group today.
Thank you so much, Martha. Those are some great updates, and I bet a lot of people are going to want to get involved in that Birth Parent National Network virtual convening, so thank you for sharing that. So I put the pictures here. I didn't put our names, I realized. So on the screen here in front of you, you see some of the members of CSSP's Young Children and Their Families team. So Amy Fine is there. She's with us today. Judy Langford in the middle is also with us today, and that's me, Kailen O'Connor, on the end. And we are going to talk about the ongoing work at CSSP. Most of you know us through our Strengthening Families work, and it is a part of the bigger picture of what CSSP does, and we wanted to share some of our other exciting work in this area. So I'm going to hand off to Judy to talk about CSSP's theory of change.
Hi everybody, it's Judy Langford, and I hope you can hear me well, and I'm sure Kailen will remind me if I need to speak up a little bit. We, at the Center for the Study of Social Policy, we work in a variety of different ways, but our goal always of all the work that we do, that you can see in the middle of the theory of change, is child, family, and community well-being. And we believe that you have to do that in 3 ways, as you can see in the circle, the blue circle that's around that central result that we're trying to get. And that is building protective and promotive factors, reducing risk factors, and creating opportunities. And I think many of you who work on the protective factors work understand what we're talking about with that. But all of those three characteristics are all about what we hope that we do is build capacity to do all of those things. Building protective and promotive factors, reducing risk factors, and creating opportunities. And then in the big circle around the edge is our organizational way of building those capacities to achieve the results that we want in the middle. We do community change, systems change, and policy change. And then the characteristics that we always try to keep in mind we're doing that are the ones in the blue: an ecological perspective, race equity and social justice, co-invested constituents, and a results-based analysis. So some of you who've worked with us on Strengthening Families for a long time can see in the Strengthening Families work how the theory of change comes to life in what it is that CSSP does. But there's also the contribution that the Strengthening Families work and the emerging work around young children has impact back in our organizational theory of change, so that we're always trying to create community change, systems change, and policy change in whatever it is that we do. So I think we're ready to go to the next slide.
There you go.
Okay. Are we there yet?
Yes, there seems to be a little lag in when I advance it and when you see it, but it should be advanced. Okay. Go ahead and talk.
And I want Amy to be sure to jump in, and we'll explain some of these a little bit more, but as we move along. But we've created within CSSP a new team that we're calling the Young Children and Their Families team. And some of you may remember we had a Strengthening Families team, but our work has emerged far beyond the Strengthening Families work that many of you have had so much to do with creating a national network and the success we've had with Strengthening Families. So our initiatives today include continuing to work on Strengthening Families and continuing to the work that's been started in a variety of different ways around Strengthening Families, and then these new projects that are emerging as we speak. So we'll come back to those and have Amy and Kailen talk about some of those as well. So
go ahead.
Amy, was that Amy who was going to say one other thing about that? I think we're going to explain each one of those. Okay. Well, we wanted to also just say especially for those of you who have worked alongside us with the Strengthening Families work, that the work that we're doing on protective factors emerges in 4 different areas today. And this is all based on things that many of you have helped us start and continue to work on. In child welfare, there are a number of locations that are working on applying that protective and promotive factors frame within child welfare practice. And that also includes some of the work with Youth Thrive, the parallel protective and promotive factors framework that's designed for adolescents. The place-based work that we continue to work on to move that protective factors approach to a community level and community-wide approach that improves results for young children and their families. And an emerging area, we'll talk a little bit about this in a minute, is some work around young families, a real special focus on young parents that is also about, it's some about teen parents, but also just about young parents who are not teenagers, but the dual developmental needs of both children and their parents during that time frame of young parenthood. And finally, in the health arena, one of the ways that we've started to do this emerged from some of the Quality Improvement Center work that again, some of you have been hearing about for a long time. The protective and promotive factors as a part of healthy development that is used in medical and healthcare settings. And we'll hear a little bit more about that. But right now, the current work on protective factors is encapsulated in those 4 different arenas. We've got projects in various places going on about that.
So for today, we're going to focus on 2 specific areas of work. First, Amy and I are going to talk about the Early Childhood Learning and Innovation Network for Communities, also known as EC-LINC. And then Judy and I will talk about a new paper that is about to be released about strengthening supports for young parents and their children in rural and suburban areas in particular. So with that, Amy's going to talk about EC-LINC.
Great, and I'm very excited to be here today. So as Kailen mentioned, EC-LINC is the Early Childhood Learning and Innovation Network for Communities. We were started by and for communities as a way to learn and grow together in improving results for young children. We focus on prenatal period through age 8, and our focus is on accelerating the impact of community-based integrated early childhood systems, and that is bringing together health, early care and education, family support, and other sectors in working together to improve results for young children and for their families. We are currently a network of 9 cities and counties, we jumped forward, that came together to tackle tough problems together. And literally they came, 3 communities came to us and said, here we are back again. To us and said we would like to, people point to us, these are communities that are quite far along. They said, people point to us as doing fabulous work, but we know there's still a lot more to be done. We would like to work with peers to figure out how do these pieces come together to most effectively help kids and families. Let's go to the next slide now.
That's what I get for trying to anticipate. Okay.
There you are. No, you did pretty well, and it's coming on the screen at the right time for me. I'm happy to say somehow here in rural Maine it's working. So anyway, our communities, we did a pretty thorough search, quite a thorough search and rigorous, to find communities that would be like-minded and would be interested in sharing together and are far enough along that they would truly be peers with each other. And so this first set of cohort of communities has a great track record in improving services and supports for young children and taking an integrated systems approach, as I said, across health, early learning, family support, and other sectors, and a big focus on tracking and showing results. So they're a fabulous group of cities and counties and their lead organizations. Next slide, please. And these are the lead organizations from each of the cities and counties that we're working with currently. 3 of them were our founding communities. That's Palm Beach County, Florida, the Children's Services Council there, which is actually a co-sponsor along with the Center of EC-LINC. And then Orange County, California's first 5, and Alameda County's first 5. We also have Ventura County in California, and then Kent County, Michigan, Denver, Colorado, Hartford, Connecticut, Boston, and Lamoille Valley in Vermont. So it's a diverse group of communities, cities, and counties, and they are very excited to be working with each other and to be working with the center as well. So let's go to the next slide. So we have 3 main ways that we work right now. One is coming together joint learning in something called learning labs, which we'll talk about in a minute. The second is serving as laboratories or innovation centers to actually test and refine new approaches that we think are quite promising or have an evidence base, but would like to refine them further. And then the third is lifting up and sharing knowledge with federal policymakers and national leaders. And that is something, I'll talk about that for a minute. The other 2 we'll talk about in more detail in a second. But the knowledge sharing with federal policymakers, we have done several what we call listening learning sessions, which brings together about 20, at most 20 people that are both either national policymakers, national leaders, and or our communities, to basically lift up the community voice around issues that we think are important to discuss, where the timing is right. We can have a real dialogue with folks that are beginning to set national policy, but could benefit from hearing what it looks like at the local level with folks who are really working directly with children and families. And we've had about 3 of those. They've been very successful. We do them on an as needed, as appropriate opportunity basis. And we look forward to doing that in the future as well. So let's go to the next slide. So these are the examples of our learning labs. I was talking earlier about joint learning. We have currently two learning labs that are going on right now, and this is where we bring together usually about 5 or 6 of our 9 communities will sign on to a specific learning lab to really explore a topic and understand it better, understand what other communities are doing, how they're approaching an issue, try to pull out the issues that are the most important issues, and then make some recommendations about how to move forward. So the first one that we put together was a learning lab on measuring the impact of early childhood systems. I'm sure many of you have done systems work, and you know one of the hardest things to do is to explain to funders or policymakers that you actually need some funding to put the pieces together. And so, and what's that glue, and what's the value added of bringing pieces together as opposed to individual one program at a time. So we've been meeting on that, and we'll be having an issue brief come out soon with detailed examples of how 5 or 6 of our communities are beginning to do that measurement. It's not a no-brainer. It's a hard set of measures to put together, but we think our communities are making some good progress on that. And then the second learning lab that I wanted to talk about briefly is our learning lab on community responses to toxic stress, which is led by Kailen, who's doing a fabulous job, and she'll talk a little bit more about it. But basically, our focus is on a community level, our population response to toxic stress. I think I'm pretty sure most of the people on this call have heard about toxic stress and heard about ACEs, and the knowledge is out there now. But the real question is, if you're sitting at a community level, what do you do? What is the response that makes the most sense, that can help to make a difference for kids and families? So our first product from that work is a definition of toxic stress from the community perspective, and we're working now on a framework of community approaches to toxic stress that will provide a definition, not only the definition, but also some examples of what folks are doing across the country and some recommendations for going forward. Let's go to the next slide, and I'm going to turn it over to you, Kailen, for a couple of slides.
Yes. So I actually shared this on our last webinar, but some of you may not have been on that, and we didn't really talk about the context of it. So as Amy described, we have this learning lab of 6 communities involved in EC-LINC, and when the learning lab first came together, we were just sort of checking in to make sure we were all on the same page, saying, what definition are you using of toxic stress? And it turned out that no one had a definition they were using consistently that they were really happy with. Some had had discussions about it in work groups and committees in their own communities, but none had arrived at a definition that they wanted to use. So we ended up making that into a task of the Learning Lab. It turned out to be a very fruitful conversation and led us to developing this very brief little handout that you can get from our website. And there's actually a short URL there, a bit.ly address you can use to get to it, or you can go to our website and go to the EC-LINC page, which we're going to share on a later slide. But really getting into building off of the Harvard Center on the Developing Child definition of toxic stress, which is very much about what's happening with a child's development in relationship to the individual people around them. But here we really talk about why we're concerned about toxic stress, what it means at a community level, and putting it a little bit more in context of the kinds of things that programs and systems can do and that communities can do to make a difference with toxic stress. I'm not going to read through this right now, but just that you can see there are 5 components to it about what toxic stress is, why it matters for outcomes, why we're particularly concerned about toxic stress in pregnant women, infants, and young children, a little nod to the fact that not all stress is bad, that taxonomy of different types of stress that matters, and then about what we can do. We know that safe, stable, nurturing relationships can help to buffer young children, and that there are things we can do to help make a difference. Now, the next thing that will be coming out soon from this learning lab is a framework of community approaches to toxic stress. And what you can see on your screen right now is the framework that this group has developed. I'm not going to read through it in detail. It will soon be coming out in a format of an issue brief where there will be examples of what communities are doing that fit each of the segments of this framework. But just so you can see that we really wanted to put responses to toxic stress in a larger context of what communities are doing to improve outcomes for children and families, and acknowledging that some of the work that we do that's most important for preventing toxic stress and even for ameliorating it when it has occurred are strategies that communities and programs have been taking for a long time, but we now understand more how important they are in the context of toxic stress and adverse childhood experiences, where other things that we're doing are newer and are fully informed by and born out of our better understanding of how parents can help to buffer children from having a toxic stress response when something bad happens, or of the kinds of services and supports that we need for children and adults, particularly parents who have experienced toxic stress, so that they can get to better outcomes for themselves and their kids. So it's a big picture of what communities are doing that goes from prevention to identification to response. And we're very excited about putting that out there and seeing how people can use it to try to find their pathway through it, what role they play. And the only other thing I'll point out about this is that we, at the very first box there, the blue box on the left, is about agents for change. So we think parents and caregivers are very critical agents for change in both learning about and developing strategies to prevent and deal with toxic stress, and that when they can come together as community residents, as parents, to develop leadership skills and partner with system and program leaders, they can really make big changes. Then we have the next agent for change group is the providers. There's a lot that we know providers can do, and I think often that's where the focus has been on when we talk about toxic stress. We're talking about what programs can do to respond to it specifically, but here this gets a little more into what else can be going on with prevention and building awareness, building capacity. And then the final bucket there for agents for change is service system, community partners, and policymakers, that there are things that we can be doing at a policy level and a system level that support providers to do the things they need to do, and that enable parents and caregivers to make the changes that they are organizing to want to make, but also that they can, that the system leaders and policymakers also play a role in setting the stage for those changes to happen. So keep an eye out for that. We'll certainly announce it in the e-update, and we encourage you to stay tuned to EC-LINC for specific updates about this type of work as well. And I think Amy's going to talk about another specific project going on right now within EC-LINC.
Right, and I just want to go back for a second. We don't have to go back to the slide. Well, we can, but what I wanted to say is I think I wanted to describe the way we work, which I think is somewhat different from many national organizations that are working with communities, and it's quite similar to, I think, the way Strengthening Families has worked all along, which is we were set up to be responsive to the needs and the priorities of the communities that are part of our network. So the toxic stress and the evaluating systems ideas came from a polling of those communities to say, what are the issues that are most important to you that you feel could benefit from joint thinking, joint problem solving. And then secondly, I think Kailen's example of pulling out a separate fact sheet on definitions came again as an example of responding to a need that the communities identified and said, you know, it would be really helpful to have this. And the last thing I wanted to say about this is that the way we work is not just responding to a need as if we have all the answers by any means, but really lifting up the experience and the wisdom of those who are working at the local level with children and families and beginning to put that together across communities and then to make it available to many more communities across the country. So that's really an approach that I think is important to understand about how we help to, how we are working now and how we hope to continue to grow in our work, working with other communities. So another project that we're doing under Early Childhood-LINC is supporting the development of an early learning nation. We have funding from the Bezos Family Foundation to do work in collaboration with the National League of Cities. We are using our cohort of 9 communities, and they have identified 7 cities that are interested in what it takes, understanding, starting to work on the idea of building an early learning community. And that the idea of an early learning community is really having kids that are ready to learn. It is going beyond the early care and education sector, but recognizing that from birth forward, we have to be working on a lot of different angles, a lot of different aspects of healthy development. And again, it brings together those sectors of family support and early care and education and health, and many other sectors as well. So 2 of the things that we'll be doing is looking at the kinds of results and outcomes that these 16 communities together are using to measure how are we doing with our kids and families, or how are our kids and families doing. And then we'll also be putting together something we're calling a playbook for early learning communities. What are the key components? What are the kind of requirements that across our communities people agree really are important if you're trying to help kids do the best they can and be ready to be eager early learners. So we're excited about that project and the opportunity to work with the National League of Cities as well, giving us an opportunity to bring these ideas to a much larger set of communities across the country. So I think we can go to the next slide.
There you go.
And okay, and this slide is on something called Project Dulce, which is developmental understanding and legal collaboration for everyone. And this is an example when I mentioned earlier that we work in 3 ways. One of them is serving as a laboratory to further test and refine promising ideas. So this is an example of what we're calling a shared implementation project. Dulce is a pediatric primary care intervention that is universally available to all healthy infants birth to 6 months in clinics that serve low-income families living in high-need communities. So that's how it was originally tested. It was tested in the Boston area through Boston Medical Center. And it's an intervention that combines 2 things. One is having a family specialist partner with the parents at every well-child visit. So the parents come in of infants from birth to 6 months. They're greeted by the family specialist in the waiting room, who builds a relationship with them and helps to support just healthy development, helps them with any questions they have, brings up ideas about, you know, let's look at your child's development, really very supportive to the family, and very positive and very proactive. And it combines that person's role with access to medical legal partnership. I don't know, some of you may already know about medical legal partnership, but this is a partnership with legal partners who can help families access services, supports, remedy problems that sometimes with just a little intervention from the lawyers, it's amazing how much could be moved to help families get resources that they need. So sometimes it's a matter of helping immigrant parents understand what they are legally entitled to in this country, what services they can actually access. Sometimes it is getting landlords to remove the mold from an apartment when it doesn't work so well when either the tenant or even doctors call and ask about it. But if you get a lawyer on the phone, sometimes that just works wonders. So it's another way to proactively address social determinants of health, to proactively prevent toxic stress. And so this combination of supports to families, building relationship, and giving them kind of a legal access to concrete support in times of need are really important. And this, of course, came out of our QIC. It builds on the work that was done under Strengthening Families umbrella. And so what we're going to do is take this successful intervention, which ended up fewer children were using the emergency room. Families were very satisfied. They were better connected to services and supports than the comparison group. And families and providers, healthcare providers, both appreciated this opportunity. So it had some very positive results, and we're going to now take it and replicate it in 5 of our communities across the country, looking at 2 things in particular, or 3 things. One is, can we get the same results? The second is, what are the core elements that we absolutely need to keep in place, and where is there room to adapt and adopt to the community setting or the clinical setting where this is being replicated? And then the third question that we're really going to be looking at closely is, what is the role of parents, both in helping to design these interventions in their and adopt and adapt them in their clinical setting, and also the role of parents as participants in Project Dulce. So we're very excited about that, and we're starting to launch that in the fall with 5 of our communities. Next slide. And this is our finale slide. We hope that you'll get in touch with us. We have an electronic newsletter that comes out monthly, which is very informative about what's going on with early childhood systems building around the country. There's sections, entries are for researchers, for families, for service providers. So there's something for everyone in it, and it's been really well received. And then the top email, the top address is how you can find our page, our web page on the broader CSSP web page. So we look forward. We hope we can hear from all of you, and let us know if you have questions, and get in touch with us. Thank you.
Thanks so much, Amy. This is Kailen. I will just add that if you sign up for the Link Up newsletter, which I strongly encourage you to do, that link there will take you to a page where you can also sign up for other CSSP newsletters. So if you're not already getting the Strengthening Families one, you can sign up for that there too. I will also say the Link Up newsletter is going out as we speak. So if you'll know today, if you're on the list, you will have gotten it. If you don't get that today, then I encourage you to go sign up for it. Thanks so much, Amy, for sharing that information. And now Judy and I are going to talk about another project. This is a coming soon report called Strengthening Supports for Young Parents and Their Children, a focus on low-income, rural, and suburban American families. So really looking at a pretty unique niche in terms of young parents in rural and suburban areas. And we're going to talk a little bit today about what's in this paper, why it's important, why we hope that you'll take a look at it when it comes out. And then I encourage you to keep an eye on the e-update and on our website, because the paper will be out soon and it will be posted there. We'll spread the word far and wide when it is ready. So Judy, do you want to talk a little bit about why we're focusing on these families?
I'll be glad to do that. I told Kailen right before the webinar started, I had this cover that you just saw is so completely new. I hadn't even seen it until she put it up. She apparently got it just in time to slip it into that PowerPoint slide. And we've been anxiously awaiting this. We've been working on it for a while, and I think. Well, there's several reasons that we felt like we wanted to go in this direction. For one thing, I think some of the subgroups underneath the bigger work that we do with young children and their families present some interesting opportunities, and we didn't really know a lot about what was going on, particularly focusing on young parents, and to some extent that those are those parents that are from sort of that age group between 16 and 30, when so many different things happen when young people either graduate from high school or they don't graduate from high school, they go to college or they don't, they graduate from college and have a huge college debt, or they're still living with their parents. And when you add on to that kind of stress, having a baby, which actually is in that age group again, is when most people begin their childbearing years. And that parenthood added to the developmental needs of those young people really poses a big challenge. And I feel like we haven't paid enough attention to that age group in the past. So if you add to that general truth about those young parents, most of the policy and programs that we know about have focused on urban populations because that's where most of the people are. And as a result, we've really neglected to try to find out more about what's actually going on in rural areas and increasingly in suburban areas where poverty is growing at a really high rate. And what happens when that happens is within a suburban area where people are accustomed to being a whole middle-class enclave, and all of a sudden some poverty is moving into that arena, it's invisible to the people who have lived there for a long time. So those suburban areas of poverty, those little pockets of poverty within a suburban area, are often pretty isolated from the rest of the community and also have fewer resources because of that. So we began to look at some of the data behind that, and the paper has a good bit of the data about poverty, about birth rates, and some other things. And I should also just say that the birth rate in general has fallen pretty significantly, but less so in the rural and the suburban pockets of poverty than in the urban areas. So we've still got a lot of work to do, and we wanted to look a little more closely at this particular age group in these particular areas. So I think the next slide is going to show some of the data, and it takes a while to look at this, but this gives you a general picture of where the lighter blue are the metro areas where there's persistent poverty, and the dark blue, which is much more geographically significant, are in the dark blue. So there are lots of pockets of pretty persistent poverty in most of those areas, and that's where we started to look for the kinds of programs. You know, the question was, what kinds of programs are there, and how would we understand what's actually going on in rural and suburban pockets of poverty.
And this is Kailen. I'll jump in and say the definition of persistent poverty here is that the child poverty rate has been 20% or higher in this county for the last 30 years. So it's pretty significant, and to see those the concentration of the rural poverty in certain parts of the country is really impressive.
So I think many of you may have seen this graphic before, but this is really how the strengthening families and protective factors that were developed through strengthening families and the youth thrive protective and promotive factors fit together. And when we understand that we're dealing with adolescents and young adults who have their own developmental needs going on at the same time, that they need to become the parents, the families for those young children, both at the same time, it's important to keep in mind those protective factors. There are two kinds of protective factors that you're trying to build at the same time, one around families and one around individual youth and adolescents and youth at the same time. So this is a complicated process, but it's one that I think we're increasingly paying attention to because of the neglect that has really been there around those young parent families. And we use consistently, we at least tried to in this paper, to use that terminology of young parent families. And that really means young parents and their young children. And those developmental needs and how we fit those together, how we help create the kinds of policies and practices that promote the healthy development of both the young parents and their children at the same time is still an area that we'll be investigating over time. So let's go to the next slide, Kailen. This is an identification of one of the things that we did when we first started. I will bet that some of the people in the webinar got a phone call or an email about helping us identify potential programs to focus on in these rural areas and the pockets of suburban poverty. We gathered a wide variety of programs. We interviewed many, many programs to start with, and eventually picked these 6 programs to do a lot more in-depth around. They represent several characteristics that we think are important when you start to figure out what kinds of programs are probably going to work or may work or have proven that they've worked in these areas. And the first characteristic, I guess, is to actually have the programs responding to the developmental needs of both children and their parents at the same time. I think...
I'm sorry, I jumped around the slides here.
The second one is that they didn't just have one program in isolation, but that they utilized and reached out for and collaborated with a number of other programs and services that were available in the areas where they were. And finally, that all of these programs and the work that they've done over time reach out into the systems that have provided and might provide and should provide some additional resources for the programs and for the other services that the children and their families in this age group need. So, and it was surprising, actually, how few programs we could find that met all of those characteristics. There's a lot of stuff going on out there, but not as much as you would think, and not as much in a more comprehensive way of promoting the developmental pathways for both children and their families. So I'm going to just, I think people can read what's on the slide. Kailen may want to talk more about this. She did some of the interviews for each of these programs. We talked to them many times. We went back to them again and again for more information so that we would have a more consistent picture across the programs, not just about those individual ones. But Climb Wyoming was one, Fostering Hope, the initiative that's in 3 different counties in Oregon. Discover Together is in 1 county in Tennessee. And then I'll pause a minute and let you read the program focus for each one of these as well. Lamoille Family Center in Vermont is in that county, and then 5 towns that are in the surrounding counties around Lamoille County. The Pascal Sykes Foundation that serves several counties in southern New Jersey. And when I went up to that part of New Jersey, they kept telling me, you know, this is below the Mason-Dixon line. It's not what you think New Jersey is supposed to be. But it's a very interesting initiative and an interesting way to put together the resources that are available to them in that community. All of these have really interesting ways that they've put together programs. The final innovative program is a relatively new one called the Prosperity Project in Jefferson County, Colorado. And it was the one suburban program that we highlighted. One other interesting finding from this whole scan is the scarcity, really, of comprehensive programs that serve young families and their children in those suburban areas. There's a lot of awareness, at least among the administrators in those areas, that there are great needs among those young families in those areas of suburban poverty, but not a lot yet of being able to put the pieces together in ways that help solve the problems of resources being pretty far away from where a lot of those families live, or of using different kinds of funding streams to provide the support that they need. So these are the 6 programs. You can read some more about them in the paper when it finally goes up on our website.
And I'll just add, I wanted to mention that a couple of the programs have people who joined us today on the webinar. So Emily Parton is with us from Discover Together, and Joyce Johnson from the Jefferson County Prosperity Project. So thank you for joining in here. And I just think it was very interesting talking to the people running each of these programs about how they were adapting existing models to be more responsive to the needs of families and the communities they're trying to serve, how they were engaging residents in making decisions. Several of these are really about community coalitions and residents coming together to figure out what services to provide. And it's a really interesting collection of programs that really are getting at developmental needs of both parents and children. And so we all know there are a lot of programs that serve children that also do something on the side for parents. There are programs that serve adults that do something on the side for the child. But these really are starting from a family perspective of meeting the needs of both. So I think with that, we can get into some of the themes that we found across the programs. And Judy, do you want to keep going or should I jump in?
I just want to make a couple of comments about that. I think we've talked a good bit about the coordination aspect and the developmental approach, but there were several elements about these programs that I think are important. They're even more important than I think we usually see. And one of them is just about the lack of resources. It's very, very hard to get together from the small funding streams that are there, and their funding streams are small, partly because there's so few people. And what that means is that there are just very few resources to be had overall. And that's one issue. But I think the other part is a corollary lack of resources for substantial evaluation. And the programs, even though they're doing a wonderful job and can tell you a lot about what the results have been for individual families, to have a really rigorous evaluation and a long-term tracking of results that would help both the program development and the potential for more substantial funding have just not been there for many of these programs. And I think that's one of the things that we'll be talking some more about. A couple of issues that we thought were really interesting. One is just how very important, and we know this is important for young families, but in these programs in particular, they really reached out to grandparents and other third-generation kin and the peers of the targeted families that they were working with, in acknowledging what an important role those people play in providing a lot of support for those young families and their children. But the programs themselves also reached out to those additional people because of the support that they provide to the folks in the program. And this takes a variety of different forms across the programs, but I think it's important, and it's an important piece of the conversation about two-generation programs that we're hearing around the country now. Another one that I just wanted to mention is and this, like a lot of the things that we come upon, it's kind of common sense, but it was really striking in these programs. All of them adapted and had to adapt to the needs and resources of their local community and to the families that they serve, rather than trying to take an existing model of a program and plunk it down in that community. And some of that had to do with the resources that were available, but a lot of that had to do with the needs of the local community and what those families and communities really needed and wanted. And that's a different kind of strategy than we see a lot of times in urban areas where there's a lot of encouragement to, here's this model, plunk it in, make it work. And I think the nuance of how these strategies were adapted in their own communities is a really exciting and interesting finding that we had. Kailen, you may want to add some more to that.
I think you covered it. Those are definitely the themes that emerged, and and that leads directly into our next slide, which is about the opportunities that exist to expand services to these underserved populations.
Well, that,
yeah, keep going.
Yeah, you want to talk about that?
You can keep going. You're on a roll.
Well, I think obviously once you start to get some information, this is not an exhaustive study. It was just a scan, really, to start with and to start the process of trying to figure out what is out there and what can we learn from that. And I think there are several things that we took away from that. One is how difficult it is sometimes, and maybe the folks that are on the phone from those programs may want to talk about this some more, but it really takes powerful leadership, powerful, persistent leadership at that local level to make these things happen, both because of a lack of information and connection to other things that are going on in other places, and to get the resources you need, and to adapt those ideas from other places to really serve the population that you have. And we feel like creating more platforms, more ways to share this work, to share the innovative strategies, to give people an opportunity to talk with each other and learn from each other about what they're doing, similar to the EC-LINC work, is really essential, particularly for these communities that are even more isolated than the counties that, for example, that EC-LINC puts together. I think the other, some of the other findings, and these are not that unusual, that there are many policies and practices that really make it more difficult to serve both children and their parents at the same time. Child care is not very well linked up with workforce development. There are other kinds of things that create eligibility standards that make it difficult. And it would be good, we haven't done it with this paper, but it would be good to analyze that more carefully and provide some suggestions for those policy and practice changes. Two other things that we found that were just interesting. One of the things once we started to look into the workforce strategies was the new neuroscience findings, which a lot of us have been talking about for a while. The developmental needs of adolescents and young adults, what's going on for them, the growth of their executive function and self-regulation skills are nowhere to be found in the workforce strategies or the ways that people in general are creating opportunities for those young people to be successful in school and college and community college or in the workplace. And it just stuck out when you started to look into what they are. And the other thing, we did ask a lot of questions about technology access. And one of the things that we know in a whole host of other programs around the country is the reliance on social media, on connections, on the use of social media and technology for people to create their peer groups and to stay in touch with each other. And in a lot of rural areas, there's fairly limited access, that unless you go to the library, unless you go to some location where you can get the kind of internet connection that you need to have to make that happen. So it's just one more barrier, I think, in those areas that we don't really think about so much. So anyway, these were some of the opportunities that we'll be on our soapbox about as this paper comes out and we start to have some other conversation about this particular age group of families and the communities where they are.
Thank you so much, Judy. And we actually just got up to the hour. So if anyone has questions and you want to stay on the line, please feel free to either type in a question or raise your hand. We can unmute you. But I know many people will need to go to their next appointment or their next phone call, as the case may be. I will put our contact information up here so that you can reach myself or Martha or Judy or Amy. And thank you all for participating. I will keep the line open for a few minutes in case anybody wants to type in questions, and we'll try to respond to those. But thanks, everyone, and we hope to talk to you again in September. Thank you. Okay, we do have some questions. A question about whether materials will be shared afterwards. Yes, we will. The e-update that comes out next week or possibly early the following week will include a link where you can get both the slides and a recording of the webinar. And you can also find that on the CSSP website in our webinar archives. And we'll get the slides up on the Alliance's Google site that you'll get the link to in the newsletter. Emily's asking for more information about neuroscience findings and workforce issues. Yes, Emily, we will be sending you the paper soon, and then we can you can see what we've got in there, and we can share, have a conversation about any questions that come up from that. Okay, I'm not seeing any other questions coming up. Let's see if anyone has their hand raised. And I think that's it. So I will go ahead and close the webinar. Thanks everyone for participating. Thank you very much to my colleagues who presented and shared information. And we'll just keep doing this good work. Thanks everybody.